Tuberculosis, commonly known as TB, is one of the world's oldest and most dangerous infectious diseases. It is caused by a type of bacteria called Mycobacterium tuberculosis. This tiny organism is invisible to the naked eye, but it can make a person very sick if not treated properly. TB mainly affects the lungs, but it can spread to almost any part of the body, including the brain, bones, kidneys, and lymph nodes. When someone has active TB, the bacteria multiply in their body and damage tissues. This can make the person feel weak, tired, and often very sick. But before understanding how TB affects the body, let's talk about how it spreads. TB spreads through the air. When a person with active TB in their lungs coughs, sneezes, or even talks, tiny droplets containing the TB bacteria are released into the air. If another person nearby breathes in these droplets, they can get infected. This is why TB is called an airborne disease. It does not spread by shaking hands, hugging, or sharing food. You cannot get TB from touching surfaces. The only real risk comes from breathing in the infected air. Now, not everyone who breathes in TB bacteria becomes sick right away. There are two types of TB, latent TB and active TB. In latent TB, the bacteria enter the body but remain inactive. The person doesn't feel sick, has no symptoms, and cannot spread TB to others. But if the immune system becomes weak, the bacteria can wake up and turn into active TB. In active TB, the person develops symptoms and can spread the disease. So, what are the common symptoms of TB? The most common form of TB is lung TB, also called pulmonary TB. Its symptoms usually include a persistent cough that lasts more than 3 weeks, chest pain, and sometimes coughing up blood. Many people also experience fever, night sweats, weight loss, fatigue, and weakness. Some may feel shortness of breath or have difficulty breathing. TB can also affect other parts of the body. When TB attacks the brain, it can cause severe headaches, vomiting, confusion, or stiffness in the neck. This is called TB meningitis, and it can be very dangerous. When TB affects the spine, it can cause back pain or even paralysis if untreated.